Hey everyone, today I'm going to perform the return demonstration of IV therapy. It includes 3 procedures. First, starting IV infusion. Second, regulating IV flow rate. Lastly, discontinuing IV flow rate. Purposes. First, maintain or replace body store of water, electrolytes, vitamins, proteins, fat, and calories in the client who cannot maintain an adequate intake in the mouth. Second, restore acid balance. And lastly, restore volume of blood components. Step-by-step process of the procedure. First, check the doctor's order and make an IV label to ensure that the client receives the correct IV solution and medication as needed as ordered by the physician. Wash hands to deter the spread of microorganisms. Gather all the equipment and prepare the IV solution and IV tubing to have all equipment available and to save time and effort. Maintain aseptic technique when opening sterile package and IV solution. Prevent the contamination of IV solution set which can infect rapidly the client. Tubing, uncap the spike and insert into the entry site on bag or a bottle as the manufacturer directs. If an additive is ordered, incorporate it before inserting the spike into the entry site. This punctures the seal in the IV bag or bottle. Next, suspend the IV solution on a hook in the preparation area and press the drip chamber and allow it fill at least halfway. Suction effect causes fluid to move into the drip chamber and also prevent air from moving down the tubing. Remove the cap at the end of tubing, release the clamp and allow the fluid to move through the tubing. Allow fluid to flow until the air bubbles have disappeared. Close the clamp and recap the end of the tubing, maintaining sterility of the setup. This removes air from the tubing, which can in large amounts act as an air embolus. Next, notify the physician or nurse who will insert the IV. When he or she arrives, brings the preparation to the bedside. Facilitate accomplishment of the task. Hello ma'am, I am Jess Kiol, your student nurse for today. I am from University of Mindanao. What is your name ma'am?
Sam.
I am going to give you an IV fluid on your hand to maintain your electrolyte. Client in a supine or low Fowler position in bed. The supine position permits either arm to be used and allow for good body alignment. The low Fowler position is usually the most comfortable for clients. Suspend the bag or bottle of solution on IV stand. The fluid height should be 18 to 24 inches above level of the vein. This height is sufficient to overcome the venous pressure. Hand the tourniquet to the doctor or nurse, followed by a cotton ball with alcohol and the needle or vasocan. Observe while the doctor or nurse is inserting. Anticipating the needs of the doctor is one of the good characteristics of a nurse. Release the tourniquet when he or she is indicate or when a return flow of blood to the adductor observed or optional can be done by doctor. The tourniquet causes increases venous pressure, resulting in automatic backflow, an indication that the needle is inserted into the vein. Connect the tubing to the needle. Start the flow of solution promptly by releasing to the clamp on the tubing. Examine the site for sign of infiltration. Blood will rapidly. If IV flow is not maintained, the needle is accidentally slipped out of the vein, solution will accumulate and infiltrate into the surrounding tissue. Insert the needle with a small piece of gauze or tissue paper under the hub if necessary to keep the needle in place. The pressure of the wall of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not anchored. Loop the tubing near the site of the entry and anchor it with plaster to prevent pulling of needle. The smooth structure of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out the vein if it is not well anchored. Next, anchor the arm to the arm board for support if necessary. An arm board protects against change in the position of the vein and acts as a reminder the client to minimize arm movement. Adjust the rate of flow according to the doctor's order. The physician prescribed the rate of flow. Complete the label of the tape to the IV fluid bag or bottle. The aftercare of the equipment and wash your hands to deter the spread of microorganisms. Documents the procedure and the client response, chart the time, site, device, use solution, and rate flow, and the physician or nurse who is inserted the needle. This provides accurate documentation and ensure continuity. And lastly, monitor periodically at least every 30 minutes to check the flow rate and observe for infiltration and other untoward symptoms. This documents the client's response to the infusion. Next, the second procedure is regulating the IV flow rate. Says, first, comply with the prescribed rate ordered by the physician. Second, to maintain an equal and constant rate of fluid administration throughout the duration of infusion. Third, to assist the reassessing the progress of the fluid infusion. And lastly, to prevent circulatory overload or insufficient correction of hypovolemia. Step-by-step process of the procedure. These are the materials needed for regulating the IV flow rate. First is watch with second hand, calculator, pencil, surgical tape, fluid label, and paper. First, review the accuracy and completeness of the physician's order and in a client medical record for client's name and correct solution, type, volume, additive, rate, and duration of IV therapy. Follow the 10 rights of drug administration to ensure the correct IV fluid is administered. Assess the client's knowledge of how positioning of IV site affect the flow rate. Fosters client participation in maintaining most effective position of arm with IV equipment. Nurse is responsible for positioning, control clamp, offsetting infusion device rate. Perform the hand hygiene, inspect IV site for signs and symptoms of IV-related complication such as pain, swelling, or redness. Observation or report of any IV-related complication indicate need to re-establish patient IV access. Observe for patency of IV tubing. IV line must be free of kinks, knots, and clots for fluid to infuse at proper rate. Paper and pencil or calculator to calculate flow rate. Use mathematical calculation to obtain correct rate. Count the drop per minute in the drip chamber. Hold the watch beside the chamber. Holding the watch next to the drip chamber allows the eyes to focus on drops and the second hand on the watch to provide an accurate count. Adjust the IV clamp and needed and recount the drop per minute. This regulates the flow rates into the drip chamber. Monitor the IV flow rate at frequent intervals and the client's response to the infusion. This provides for observation of the IV infusion and the client's response. And the last procedure, discontinuing of intravenous infusion. Identifications. First, the client's oral fluid intake and dehydration status are satisfactory so that no further IV solution are ordered. Second, there is a problem with the infusion that cannot be fixed. Lastly, the medication administered by IV route are no longer required. Step-by-step process of the procedure. These are the materials needed for discontinuing the IV infusion. First is wet and dry cotton balls, IV ticket, plaster, receptacle box, and working gloves. Check the physician's order for discontinuing IV infusion. Prevents inadvertently discontinuing the IV and having to restart it. Know your name?
I'm Sam Kardashian.
Can I see your ID, Van?
Yeah.
Okay. Ma'am, I'm going to discontinue your IV fluid by your doctor's order. It is okay, ma'am?
Okay.
Release anchorage of arm, tubing, and needle. Loosen the tape of the venipuncture site while holding the needle firmly and applying counter-traction to the skin. Movement of the needle can injure the vein and cause discomfort to the client. Counter-traction prevents pulling the skin that causes discomfort. Don gloves and clamp the infusion tubing. Clamping the tubing will prevent the fluid from flowing out of the needle on the client or bed. Hold a swab above the venipuncture site. Withdraw the needle quickly by pulling out along the line of the vein. Pulling out in the line with the vein prevents injury at the vein. Immediately apply firm pressure to the site using the swab for 2 to 3 minutes. Pressures help to stop the bleeding and prevents injury at the vein. Hold the client's arm or leg above the body if any bleeding persists. Raising the limb decreases blood flow to the area. Check the needle or catheter to make sure it is intact. Report a broken needle or catheter to the nurse in charge immediately. If the broken piece can be palpated, apply a tourniquet above the insertion site. If a piece of needle or tubing remains in the client's vein, it could move centrally toward the heart or lungs and cause serious problems. Application of the tourniquet decreases the possibility of the piece moving until a physician is notified. Apply the dry cotton ball or band-aid to cover IV site. The dressing continues the pressure and covers the open area in the skin, preventing infection. Discard used supplies appropriately, remove gloves, and wash hands. The dressing continues the pressure and covers the open area in the skin, preventing infection. Amount of fluid infused on the input or output record sheet and on the chart if necessary. Include the type of solution used, type, time, and reason for discontinuing the infusion and the client's response. This ensures accurate documentation of client's response. I am Jess kiol. Thank you for watching. Bye!